Hello, this is Mark L. White with Health Hacks, and I have my good friend, Dr. Ian White, joining us. And I've known you now for, it's probably been about 4 or 5 years. And Ian is probably one of the most well-versed scientists studying stem cells. I know you've been working on a lot of other different things. And you've recently just moved from Miami to the exciting place of Gainesville, Florida.
Yeah. First, thanks for the invite to come on here, Mark. And it is just a coincidence that we have the same last name. There's no relation, but you are a good friend, so thanks for having me on. We're now here in Gainesville. We're affiliated with the University of Florida because we're at the Sid Martin Innovate Biotech Center, which is the #1 biotech incubator in the world currently. So we're very excited to be here, and we're very excited to be doing the kinds of research that we're doing.
You know what I love about you is every time I talk to you, you're always telling me about, like, you were one of the first people I met who were talking about stem cells and all the exciting uses for it and all the secretagogues from stem cells that are out there. And right before we got on the show, you were telling me, hey, we now use these things for pregnancy. Tell me what's going on.
Yeah, well, I'm actually one of the few people in the space with a PhD in stem cell biology and with a focus on regenerative medicine. So what a lot of your viewers may not realize is that the term stem cell and regenerative medicine isn't really interchangeable. So we study stem cells as a tool for regenerative medicine, but when we actually talk about in the clinic, the cytotherapy, the cells that are derived from the products and usually given to patients are typically devoid of stem cells. So they don't contain stem cells, but they do have a lot of regenerative cells. And along the same theme, the products that we focus on are perinatal derived. So they're derived from birth tissues that are usually thrown away after birth. So after a healthy birth, after a healthy cesarean section, the placenta, the cord, and the amniotic fluid is considered waste product and it's discarded. But in that product and in those products are tissues that are incredibly valuable for regenerative medicine. And one of the products I'm going to be talking about today is called Cytosomes, which is an extracellular vesicle that's found exclusively in amniotic fluid. And it's amniotic fluid that we're really focused on right now because of the amazing potential that it has in regenerative medicine.
Let's start from the beginning, because I think most viewers, including myself, like the first time I've heard of stem cells was probably 20 years ago, where the government was talking about how we're destroying fetuses and using these magic cells at the expense of fetuses, which isn't the case. I know there was some mistruth to that. And then you're talking about now you're deriving these from discarded placenta. But let's just kind of walk through the ethical issues. These are women who have given a live birth, correct?
Yep, correct. Healthy live birth under consent. So maternal consent.
Maternal consent. They've been tested, right? So they're not.
Tested. Yep. So all of the tissue that's collected is collected by a tissue bank that's accredited in the United States and FDA registered. And the tests that they have to perform on that tissue are the exact same tests that any tissue has to go through that's transplantable. So if you're talking about a transplanted heart or a lung or a kidney, they go through the exact same infectious disease testing and background checks as the placenta or the amniotic fluid does.
So why is this controversial? Even now, I know recently the FDA is trying to crack down on some of this stuff. I know you and I were talking about that just a month ago, and I see a lot of people changing things. But why does the FDA care when this has so many great benefits for humans?
Okay, so there are really sort of two issues at play here. So the first is a misconception, and that misconception comes from the term stem cell. So when we are studying stem cells in the lab during my PhD, for example, we studied embryonic stem cells sometimes, and we studied iPS cells other times, which are an artificial derived version of embryonic stem cells. We also studied mature tissue-specific stem cells, but the controversy comes from embryonic stem cells. So embryonic stem cells come from the blastolema of the embryo that's discarded from IVF treatment centers. So when you fertilize several eggs. Many of them are discarded. But what scientists can do is take some of those cells, those ES cells, and use them experimentally because they can differentiate into all kinds of different tissue. Now, we don't work with that. We don't work with those kinds of cells and those kinds of tissues. We work with mature tissues, so like the fully formed cord and the fully formed placenta and the fully formed amniotic fluid. So we're able to sort of step away from that controversy because we don't work with embryonic stem cells, so the fetus and the baby isn't harmed at all. And in fact, before we touch any of the tissues, the baby's already born and is usually with the mother or with the nurses. Then the afterbirth comes, the placenta, the cord blood, all that material, which is usually thrown in the medical waste, is then harvested by an FDA registered cord bank. And then it is shipped to us under consent from the mother, who understands that it's being used for research or transplant. And we're able to process that tissue in our ISO 7 CGMP compliant clean rooms. So that means we're certified. We demonstrate a certain level of safety and security, and we're able to make those tissues and turn them into something useful for research and clinical trials.
Okay, so when you're talking about it's cytocells, right?
Cytosomes, yeah.
Cytosomes. So you're talking about cytosomes. These are embryonic fluid from the embryo, or that's from the cord?
Right. So when the baby's developing during ontogeny, during development, the amniotic fluid starts to build around the baby. And so the baby is floating in this sack of liquid. And for the beginning of that process, a lot of that liquid is derived from the mother. But towards the end of pregnancy, it's actually derived from the fetus. And it's a critical product, actually, because a lot of people think it's just something the baby floats in, but it's actually not. It's full of growth factors and cytokines and cells and these extracellular vesicles called cytosomes, which signal between the baby and the mother so that the mother knows, first of all, that she's pregnant and she can modulate her immune system not to reject the fetus, but also her body needs to undergo certain changes, physiological changes to handle birth. And you might have heard that some people say that pregnant women glow. It's because their skin physiology changes, and also their cardiac output changes, and their mental physiology. And in fact, the incidence of cancer in pregnant women decreases substantially. And this is all because of the signaling between the fetus, the placenta, and the mother. And that's all mediated through these very, very tiny extracellular vesicles called cytosomes.
Now, when you're talking about regenerative medicine, you're talking specifically about all the medicine, whether it's amnio fluid or cytosomes. Now, if you have cytosomes, and I know you've done a lot of testing, how does that help somebody like myself or somebody who's, they're getting older? Like, what are we using those for? And what are you most excited about?
Yeah, so technically what we're doing is we're hacking pregnancy here. What we're able to do is take a product that has evolved for pregnancy. So it's evolved to help the fetus grow, and it's evolved to help the mother deal with the rigors and stresses of pregnancy. And we're able to reach in and take that product and use it for tissue regeneration or for anti-aging. Let me give you an example of how this might work. If we're talking about cosmetics, for example, so these products are often used in cosmetics in lieu of something like Botox. Because as you know, Botox is a toxin, and over time, that toxin being injected into the skin could have many potential side effects. We don't know how neurodegeneration is affected by constant exposure to this botulism toxin. So the idea is that we take these products from amniotic fluid, which we know are safe because the growing fetus is surrounded in it. And we've been doing research in this for decades, and clinically it's been around for a long time also. But when we inject these extracellular vesicles into the skin, they contain the RNA, so the signaling molecules of the fetus that the adult doesn't have. And those extracellular vesicles are able to bind the host cell, release the cargo into the host cell. So for example, a mature fibroblast. Fibroblasts are responsible for making collagen. As we get old, those fibroblasts lose the ability to lay down all of the nice collagens that babies have. So we talk about having baby soft skin. Those collagens are absent from the adult. However, those RNAs that signal for those fetal collagens are still present in the amniotic fluid. And we're able to take that, inject it, those products can go into the adult fibroblasts, and then those fibroblasts can again make fetal collagens and reduce the signs of aging in the skin.
So it's great for an aesthetic. I know that people are using it for hair loss. We've seen sexual wellness and rejuvenation around the penis and the clitoris, but you're talking about hacking pregnancy. I've never heard of that before. Is it helping women who are trying to get pregnant, or is it helping them deal with a tough pregnancy?
So it's not helping anybody get pregnant. What it's doing is we're taking a byproduct of pregnancy and using it for health medicine. So to treat people who are aging. So aging is a chronic disease where our ability to heal decreases as we age, but also we undergo chronic inflammation. And that chronic inflammation is responsible for a lot of the disease we see in aging. And what this amniotic fluid is able to do is it's able to modulate inflammation. It's actually able to reduce aging in a way that we haven't seen before. There are a set of experiments actually called heterochronic parabiosis, which is where scientists took an old mouse and a young mouse and connected them through their bloodstream. And what the scientists were able to observe at Harvard University was that the factors, something in the young animal in that blood was conferred to the old animal, and that old animal actually started showing signs of anti-aging, which means that it healed faster, its coat hair started changing to a darker color again, and all the things that are associated with being healthy and young were conferred back to that old animal, and we're able to also observe that with the amniotic fluid. It's the same principle, taking the young material and giving it to the old individual and conferring the young ability to heal and repair tissue.
Okay, so let me get this straight. We have this natural regenerative medicine that's produced when women are giving birth, which is a wonderful thing that would have been discarded. We've shown that it actually makes people feel younger, look younger. It helps with sexual wellness, regeneration. It helps with injuries.
Yes.
Am I missing something? But why is this so freaking controversial?
Well, I guess really because it's relatively new. We're still doing a lot of research on it, but the main problem is that we're not a pharmaceutical industry. Like in the pharmaceutical industry, you're able to make a drug and you're able to make it at a very specific concentration, and you're able to spend millions of dollars studying the pharmacokinetics of that product, because the big pharmaceutical companies know that once they demonstrate all these things, they can apply for patents and have a multi-billion-dollar product on their hand. We just can't do that in the regenerative medicine field because we're talking about natural products that inherently vary from pregnancy to pregnancy. So it makes it very, very hard to characterize this stuff and demonstrate to the FDA that we're using the same product every single time. Now, the analogy that I like to give is like a car manufacturer. When you go out into the street, you see many, many different types of cars, but they all work. They all work very, very well. But there are some brands of cars that are identical. So if you have a Toyota, you might have a Toyota Camry, they're all identical. So our lots, when we manufacture the product from a single amniotic fluid, they're all identical. The problem is that when you change manufacturer, or in this case, when you change lots, you change pregnancies, the physiology of that product changes. It still works. All the different cars still work. They just have different characteristics. And the FDA is really having a hard time right now understanding how to regulate this, because the products are so varied, but also there are so many bad actors out there. There are so many labs out there without appropriate qualifications, without certifications, without appropriate labs. As I mentioned before, we have a CGMP certified lab. We have a ISO 7 certified clean room. We're doing it the right way.
You're also working with the University of Florida, which is a very credible university.
Yep. So the FDA are just having a really hard time reconciling right now how to understand the field of regenerative medicine, because it's growing so fast and there are so many bad actors, and the FDA just doesn't have the bandwidth.
I was actually thinking it's kind of like water. You can't patent water. It comes naturally. It's good for us.
Yeah.
However, the government does have a say in making sure your water isn't tainted and isn't full of impurities.
Yeah.
So I do see that. But let's say you're a consumer, and I know that the FDA has just put down new regulations that is probably going to affect the whole industry. Well, I guess my first question is, when those regulations go into effect, does that mean people are now going to have to travel overseas to do this, or are people still going to be able to do it here? And if so, how?
Yeah, unfortunately, what's going to happen is that a lot of physicians will stop offering regenerative medicine because they're concerned that their practice may be shut down. And so that's going to result in two things. Either patients who are used to receiving regenerative medicine have seen good results and want to continue using it, or for new patients who want to use it for the first time, they may have to go to sources outside of the country, which of course have their own set of problems. If you're going to countries that don't regulate tissue use as the United States does, you may end up getting tainted product, and actually it may end up harming patients, which is sort of the FDA's mandate is to protect patients. But if they're having to go abroad where there's often little or less regulation, they could end up getting hurt. And the other alternative is that they will go to some of the bad actors. Some of the companies out there that are completely unregulated and don't care will continue to make these products and continue to harm people potentially, when the rest of us who are trying to do it the right way will have to apply for INDs. So these are applications with the FDA to go through a clinical trial, which is very, very expensive and takes a very long time.
That's like the 251 versus 261. This podcast is brought to you by Vitality Connect. Vitality Connect connects health conscious people with vitality minded doctors. To find a practitioner near you, go to vitalityconnect.com.
So the 361 versus the 351 designation is how the FDA regulates specific tissues. So exosomes, cellular therapy are regulated as a 351 product, which is regulated at the highest level as a drug. A 361 product, which means that the product is taken from a source, minimally manipulated, and then reintroduced back into the patient. So typically like a PRP is something that's a good example of a 361 product. Those aren't regulated by the FDA the same way, and 361 products can be used without a biological license. 351 products need a biological license, or they need to be administered under an active IND. So if a physician or a company has an active IND, the patient can enter into that clinical trial and be treated with that biologic. But the problem is not all physicians are going to be able to have access to an IND, and not all companies are going to be able to afford an IND, and it's a very long and costly process.
So where are you right now? You've applied for the IND. It's going to take a while to get approved. Are we talking about these things coming off the market for a couple of years, or are still people going to be able to just find doctors that have the IND?
Yeah, so we're in the process of submitting the IND for post-COVID syndrome, actually, but patients can still find physicians that administer the products. It's really about the physician getting under an IND and then having access to these biological products and then administering it to the patients. So it's really going to disrupt the industry. I feel that a lot of patients are going to end up going to unreputable sources because the reputable sources are going to be concerned about getting under an IND and doing it the right way, which is currently going to be very, very difficult for them.
So paradoxically, what the FDA and trying to do the right thing is going to create more danger for consumers, push out the good actors, and you're going to have a lot more bad actors filling in.
Because there's going to be a huge demand for the regenerative medicine that people take on a daily basis. You know, sports athletes are constantly getting injured, and whether they admit it or not, the majority of them are taking or receiving some form of regenerative medicine to help with their healing process. Now, once all that goes away from the legitimate sources, they're going to have to get it from the bad actors. And then we're going to start seeing a spike in injuries, potentially deaths. But certainly the idea of making it safer is going to have the paradoxic effect of making it more dangerous, I believe.
Or what you might have is they do this, and then a couple of months later, you have presto, Pfizer exosomes and Eli Lilly stem therapies.
Well, that's a possibility too. We've been wondering what the big pharmaceutical companies have been doing all this time, whether they're just sitting, watching what the rest of us are doing, and will maybe swoop in and make some purchases. We just don't know yet. But those are the guys that have the money to do the research that we need to do to demonstrate safety and efficacy of these products. And that's why we're here at the University of Florida, because this is a great resource to demonstrate that these products are not only safe, but also effective.
And I do know that there are people who get stem cells from their own bone marrow, and they also get it from fat.
Mhm.
Is that also not going to be available?
So everything's regulated by the FDA, and the FDA have brought out guidance that covers adipose-derived MSCs and bone marrow-derived. So every treatment that is not currently FDA approved, and there are none really, there are no biological licenses that have been awarded by the FDA currently. So any treatment that is not same-day surgical, so if you take bone marrow out and use it for a bone marrow purpose, the FDA considers that a same-day and autologous treatment. However, if you take that bone marrow out and you put it in a joint, the FDA does not consider that the same way, and you will need a biological license to be under an IND in order to perform that.
How about if doctors are doing this off-label and not prescribing it to treat a certain disease, for example, general wellness, health, like you were saying, cosmetics?
Well, so cosmetics are regulated differently compared to the medicines that we're also making. But as far as using something off-label, now, if you ask somebody like Peter Marks, and I certainly don't want to speak for him, but I think what he would say is that in order to be off-label, it has to be approved for an indication in the first place. So
it has to be on. You can't do something off-label unless there's a label, and since there's no label,
that's exactly right. There has to be a label in order to be able to use it off-label. So if there's an approval, a physician can order that product. It's been approved. It's been demonstrated that it's safe and effective, and they can use it for whatever their medical training determines is appropriate. But if there's been no approval, then you can't use it off-label.
Sounds like catch-22.
Well, we're in a very sticky situation because patients are using these products on a regular basis, and they're benefiting in a way that canonical and allopathic medicine has not been able to help them. And we're really worried that all the patients are going to be pushed towards these bad actors because they're the only ones that are going to make it freely available. They continue to advertise, they continue to make claims. We're working very, very hard to demonstrate safety and efficacy, working very closely with the FDA, and we want to bring this to the public. But right now, with the end of discretionary enforcement, it could be a very challenging period ahead.
What does this mean for you, doctor?
Well, we're focused heavily on the research. We're going to be focused very heavily on IND applications. In order for our products to be used by patients, we're going to have our products covered by an IND. So we are not a big company. We are not a particularly well-funded company, but we are putting all our financial resources currently into applying for INDs and demonstrating safety and efficacy through small phase 1, phase 2 clinical trials.
Okay, what's the most exciting thing that you're seeing in your research? I know we talked about cosmetics, we talked about generation. I know that it's been used for orthopedics for a long time, but I've heard things about how it's been helping with COVID.
Yeah.
And that's exciting. But what do you think is going to be the most exciting thing to come out of all of this?
Well, we're very excited about the treatments for COVID, obviously, because that's the focus of our first IND. We'll be looking at treating post-COVID syndrome because these amniotic fluid cytosomes are able to modulate the cytokine storm that we see as a pathology associated with COVID. And also they're able to promote tissue repair, because if we look at animal models, we know that lungs and the gastrointestinal tract do not develop properly if they're not exposed to amniotic fluid. So we're very confident about that. But as far as what's the most exciting thing, well, as I mentioned before, aging really is a chronic disease. And if we can treat aging, we can treat a lot of the problems that people experience on a daily basis, whether it's pain or whether it's a lack of healing, whether it's peripheral neuropathies. And so what we're doing right now is we're partnering with collaborators to study the epigenetics of the immune system and other cells in the body after they've been exposed to amniotic fluid cytosomes. And what that means, the epigenetics of a cell means that the DNA in your cell never changes. But over time, certain genes get switched off and certain genes get switched on. And they do that through these, what we call epigenetic changes in the histones. So that it opens up genes to be transcribed or closes off genes. What we want to do and what we're starting to see now is that amniotic fluid sort of resets the epigenetic landscape of an individual, and the aging phenomena that's turning off all of the regenerative ability of the body is now being turned back on again. So we're reverting the body back to a more fetal-like phenotype. So the body behaves more like a young individual when it comes to healing and repair, because we're able to turn off those marks with the amniotic fluid and start afresh, basically. So that's a very exciting opportunity.
It's like Benjamin Button.
Yeah, sort of. Yeah. So we wouldn't physically get smaller or younger, but what it means is we would be able to live longer, more healthy. So we would be able to activate all that endogenous ability to repair, which our body has, but has just been turned off because of aging. We're able to turn all that back on. It means that we can reduce all these aging related symptoms, neurodegeneration, eyesight loss, all these things that cause us problems as we age. And we may be able to see people living into their 200s, but living as a 30 or 40-year-old.
Well, that sounds exciting, a little scary what that's going to mean for our population. But I love your passion. I've always respected everything you've done. And one thing I do know about you is no matter what the landscape looks like, you're always going to be there because of your passion. And I'm excited about what's going to happen over the next few years. This will just be a speed bump.
Yep, it's certainly going to be a challenge moving ahead, but I've spent 20 years of my career in this space, and I expect to continue my career in this space. And I hope that I'm one of the leaders that the administration and the powers that be and the decision makers come to, particularly in the FDA, when they want to talk about regulations and guidance. And I hope that I can contribute my experience to them understanding what the potential is of this industry and how we can move forward together.
Thank you so much for your time, Doctor. Hopefully you come back down to Miami. We miss seeing you down here. But
I'll be around for sure.
Okay. Take care. Have a great day.
Yeah, cheers, Mark. Thanks.
Cheers.